Can you describe for me what kind of situations call for a C-section?
Absolutely. So there can be either maternal reasons that we need a C-section or fetal reasons where there's something that's concerning with the infant, or sometimes concerns with the pregnancy itself. So something such as having a malpositioned baby. If baby's butt is presenting first instead of the head, that's usually not the way out. And so in that case, you may need a C-section. That's one of the more common reasons. Another one is if there's multiple babies in there and they can get tangled or get stuck, or sometimes women don't want to take the risk of trying to birth multiple babies vaginally. So if you have twins or triplets, that's another reason. And then sometimes moms have conditions that don't allow them to have vaginal deliveries, some heart conditions, or if the placenta is blocking the exit ramp, sometimes the placenta will implant in front of the cervix. You physically cannot allow for a vaginal delivery because that would lead to excessive bleeding from mom and baby.
Gotcha. This is a surgery. As someone who's been through it, a very intense surgery, what are we talking about as far as recovery?
Oh my goodness, yes. So it is major, major abdominal surgery. Okay. A C-section is actually, it's the most common procedure that's done in the US surgical procedure, but I mean, it is as gruesome as it gets in terms of pain, in terms of recovery, in terms of limiting mobility. And so although the procedure itself is relatively quick, most of them are an hour or less, or even if it's a repeat C-section, sometimes it's a little bit more than an hour, but overall the procedure itself is short, but the recovery can take weeks to months. Okay, so definitely there is significant amount of pain. It limits mobility. There's also the emotional trauma that comes with having a C-section. Sometimes this isn't the birth story or the birth plan that the mama had in mind, and so to come to terms that they needed a C-section is often difficult as well. So.
How can husbands, family, how can they support mom in the week after a C-section?
So, I mean, the biggest thing is going to be their moral support, their physical support, helping them in and out of bed, helping with diaper changes, passing them baby, helping with bottles, washing, pumping, nursing, feeding, kind of everything. Just knowing that, if after going through everything that the mom goes through for 9 months and then having to recover herself while she's learning to care for a newborn, just having someone there to listen and lend a helping hand is it's phenomenal. I mean, that's amazing support.
You talked about this a minute ago, but this isn't usually part of a mom's plan or her birth plan. Mm-hmm. It's medically necessary in instances, but there still seems to be this stigma, and you see it a lot on social media, of moms talking down to or degrading other moms, saying this isn't real birth if someone had a C-section. How do you address the stigma surrounding C-sections with expectant moms or moms who have had one?
So, the first thing I say is this is not the easy way out. It's actually the opposite, okay? The recovery is harder on mom, on baby, and believe it or not, on us, okay? A C-section is more difficult for the provider to perform as well. And so we're all on the same team. We would much rather this baby come out vaginally, but sometimes for mom's safety, for baby safety, we ended up having to have major abdominal surgery. And so know that you birthed this baby, okay? It's still your journey, okay? Your body did not fail you, okay? You should be proud and strong and know that you have the scar to prove it, that you went through this, and your baby will never know and say, oh, mama, you gave birth via C-section versus a vaginal delivery. They just want a happy, healthy mama, and that's all we want as well.
Was there anything else that you wanted folks to know about cesarean sections?
Yeah. So, I mean, have the conversation with your doctor, take a minute, know that sometimes we can't plan for these things. And if it does comes up at the time of labor or the time of delivery, and it is a surprise, just know that, your team is rooting for you and they just want you to be safe, want baby to be safe. And so having that conversation before and building that trust with your doctor will be extremely important, because it is scary. Rolling into the operating room is frightening, but know that we are there and we will hold your hand each step of the way and we will support you in any way we can.